Good morning and welcome to Town Talks. I'm Newell Arnerich, Mayor of Danville. This is Friday, May 6th. It's 9 a.m. We're delighted here today as this month is celebrating and talking about mental health. And today we are joined by four people who are going to bring us really wonderful perspectives, particularly talking about things that are happening in our community about mental health. And also to let you know, how can you help? And what role can you play in that? And as always, we sort of start with a video. I've created one today, a challenging thing to do, but something hopefully that is thoughtful about mental health and to kind of set the tone before we start our questions and answers. So I'm going to share my screen and play this video. Well, good morning again. And I would just like to take a couple of moments and introduce our special guest here today. We're delighted to have from Assembly Member Rebecca Bauer-Kahan's office, District Director Shawn Kumagai, who is joining us this morning. Good morning. We also have Deputy Chief Jim Selover, who's in charge of emergency services with San Moon Valley Fire Protection District. And he's going to talk with us this morning about a really exciting new program. And we have Dr. Nitsa Dimitrakos from Discovery Counseling Center, who is our clinical director there. And I confess, I have been involved with Discovery Counseling Center since 1999, a long time, and excited about the things that they're doing. And we're also really especially delighted to have Dr. Chad Pierce here from Contra, Costa County Behavioral Health Services here. And each of us today have, or each of our guests today have some really unique stories. And we're going to start with Shawn. Shawn, welcome. And, you know, the Assembly member has really had a passion. She has young children in her family. She has seen the pandemic. In fact, much of her Assembly career has been under, you know, sort of this house, I wouldn't say house arrest, but under these unique circumstances of COVID. And so she has fought really hard to come up with a new program. And we hear about it, it's called 988. So Shawn, can you tell us about what is the 988 program and what's the hope for that? And what can we expect in helping our community, and particularly in mental health?
Yeah, thank you, Mr. Mayor. Thanks for having me. And first off, the Assembly member regrets not being able to attend in person. This is an issue that she's passionate about. The bill that she's carrying, AB 988, is her signature bill this legislative session. And the reason why she ran it is because 1 in 6 Californians live with a mental illness, but only 1/3 of them receive treatment. And as many as 1/3 of the individuals who are living on the streets in California have a mental health condition. So we were granted a unique opportunity in 2020 when both chambers of Congress unanimously passed and the former president signed into law the National Suicide and Mental Health Crisis Hotline Designation Act. And what this does is it creates an alternative to 911. So when people dial 988 starting this July, they will receive some type of mental health crisis response. But the Assembly member believes we have an opportunity. We have an opportunity to design exactly what this program will look like here in California. And she believes California can be a model for mental health crisis response nationwide. So she crafted this bill, which is a framework for a well-funded mental health crisis response system. This legislation is Did not completely cross the finish line last year. We did have an important victory, though. We secured $20 million in funding to get the 988 crisis line up and running when it goes live this July. The funding will provides enough resources for about a year. We did ask for additional funding in this year's budget. We want an additional $8 million for our startup funds. And we're really pushing for an investment for sustaining ongoing funds.
Great. So what are the real outcomes that you expect, and how long will it take this to be robust? You know, we think of 911 as the default. How do we get people to rethink, and what are we going to get? So what's on the other end of that?
Yeah, that's a great question. You know, we're less than 100 days away from this going live, whether we're ready or not. When people dial 988 in July, they will get some type of mental health crisis response. The default is it will go to the National Suicide Prevention Hotline, which is great. You know, we want people to have that resource, but we really want it to be a much more robust and well-funded mental health crisis response system here in California. So, you know, we want, when people dial 988, we want them to have someone on the other end, someone to come to them wherever they're in crisis, and someplace for them to go if they need to go into treatment. So primarily right now, we see a public safety rather than a health emergency response. And, you know, oftentimes this can create a traumatizing system where people who are suffering from mental illness are either placed into confinement and funneled between jails, or they're put into emergency rooms, or sometimes in the most severe cases, they end up on the streets, and that's just not, you know, humane. So we want to make sure that we're laying a clear framework and a funding mechanism so that we have an effective mental health crisis response system. We want to make sure that we add accountability in that system so that people don't fall between the cracks. So, you know, right now we want to make sure that, or what she's really trying to do is get that funding mechanism in place. You know, a rough calculation of the 988 system costs could put it at around $974 million per year. So we have a significant one-time and limited term federal and state investments, but we need these ongoing resources to make this really work. So if we want to create a true alternative, we have to have a funding mechanism, and the National Suicide Hotline Designation Act allows for that. So that could look like a small monthly fee on phone bills like we do with 911. Right. It would generate some of the revenue we need to create the call center infrastructure and fund these crisis response resources.
So the short-term barrier, and I know the Assemblywoman, I actually met with her day before yesterday. We were talking about other things and a little bit on this. And I think she indicated that there was a need, and one of the things now to get this up and running, that there's an additional funding, local funding need. What can we do to help on that? And what are the barriers, you think?
Well, right now, what we have in place, you know, and we're going to hear from our county, and we already have pilot programs throughout the district and across the state. And so those have, you know, funding needs locally. For the 988 system, we have identified a gap for this year to get it up and running, and the Assembly member has put in a budget request to close that gap. So hopefully, you know, right now the budget's in negotiation, and hopefully, you know, we will get that budget for that funding gap filled, and that will allow us to move forward for the upcoming year.
So a last question: where specifically can we, and people who are listening in today, where can we send letters of support for AB 988 to get this, particularly this additional funding? Where should we send that?
You can, if you're a constituent of the Assembly members district, you can go visit our website, visit the Assembly members website, and we have a form under the Contact Us where you can lodge opinions about bills. You can lodge your support for AB 988 and any other legislation that we're contemplating. You can also go to the main Assembly website, and there are places where you can submit opinions about bills as they make their way through the legislative process. So AB 988 will go through the Senate. It'll come back to the Assembly for reconciliation changes. And each step of the way, it'll go through various committees. And each of those committees, you have a way to submit an opinion and support for that piece of legislation. We invite anyone to join us in support of this much needed infrastructure idea, and contact our office.
Great, Shawn. Thank you. And thank you to the Assemblyman Rebecca Bauer-Kahan for all the work in this area. And I just want to reiterate, when you send a letter in, it actually has to go in through one of the portholes through those. It actually is like a tally system. They do keep track. And what I mean, it's not so much our Assembly member, it's the other members of the Assembly or the Senate that look at that. They want to know, are people in their own district supporting this call? So let's do our best to do that. Well, great. Well, thank you, Shawn, and we really appreciate that. We're going to come back to you a little bit later in the program. Well, now we're going to turn to Deputy Chief Jim Selover. Jim, welcome. We're excited to have you here. Many of us, and I know you in your career, and I have done it being mayor and also having been around Danville long enough. I've been on some difficult mental health calls, and we all know that the response traditionally has been the police first and fire is the backup. And I remember a case, a young man I was trying to help, his parents were desperate. They made the call, and the minute he saw that the police cars showed up, he ran, and he was in panic. And he didn't have the connection that they were just there. Fire was there to sort of help to transport. So there's an exciting program that you, Chief Paige Meyer, and your whole team has been thinking about, and you have a pilot program that's going to start in San Ramon. Jim, can you tell us about what that program is and kind of the details and where we're at with that?
Yeah, thank you, Mayor. Good morning, everybody. If you don't mind, I'll just start off with a little bit of a why now for us as it pertains in regards to the fire district. Over the past decade, we've seen a steady rise in our behavioral health related calls. Last year, we had approximately one behavioral health type call within 21 hours. Basically every day we're getting one call. Right now we're on track to be about 500 calls this year for our entire fire district. Compared to other types of responses, behavioral health emergencies are associated with fewer downstream resources and are typically more time consuming. If someone's placed on an involuntary hold, we're pretty much allowed to go to one facility, that's county PES. And it's not uncommon, not only with PES, but with other emergency departments, there's wall time. Specifically with PES, it could be commonly 2 hours. We've seen 3 to 4 hour periods of time where we're waiting to offload a patient. So that basically takes resources from the fire district for the what next, other emergency calls, fire calls. Doing all this with really a minimum amount of training and minimum collaboration with our stakeholders. My experience, I went through paramedic school in 1994. And talking with our newer paramedics, much hasn't changed, but we're looking really a half day to a day of a very broad overview of behavioral health type emergencies. So limited training going into this. Our own experiences and national calls to action to improve behavioral health emergencies and crisis led us to begin exploring ways to transform the way we look at these and respond to them. Our explorations kind of leading us to begin efforts to improve our response to behavioral health emergencies and design a behavioral health co-responder solution that will provide consumers basically the right care, right time, in the right setting. To do this, we're looking at basically working with community partners, law enforcement, community health services, and county EMS to kind of help us in support of this project. We know we can't do it alone. And there's lots of opportunities there, we feel, with collaboration and making a difference. So that's kind of what started this for us. Just like you, I know you're committed, the council in Danville is committed to change and providing the best services that we can for our district, our citizens. So kind of the key goals of this project, or our objectives, is to design a behavioral health co-responder solution that, again, provides consumers with the right care, right time, right setting. And then the quadruple aim from that, the downstream hopefully effects of that is reducing rates of incarceration, involuntary inpatient care, reducing rates of unnecessary emergency department presentations, and then, like I mentioned too, increasing our reserve capacity to be able to respond to the what next type calls. And ultimately, it's improving experiences for our patients, and also for our providers, giving them the tools to be.
Yeah, Jim, I think it's really exciting when you think about it at the high level. The idea of having a police officer who has a role and a background in training, carries weapons. Its primary role is to protect the public. Having that person show up for a mental health crisis, as we know, and even some of the questions we've seen over time in our personal experiences, does intimidate people. People like, as the Chief Paige Myers said, people like firefighters. They're there to help. It's kind of like the difference between your family doctor and an ER doctor. An ER doctor never gets to learn your name. You might be unconscious, you're in terrible shape. They see you at your worst, versus your family doctor there is like your counselor, your friend. And I think having that first responder, particularly, we're very fortunate. And this is, it's not true in all areas, that in the San Ramon Valley, the level of service that we have for our firefighters, that every truck, every vehicle has somebody that's medically trained, is unusual. Most agencies only focus on fire, and it's a third party or private company that's just there in case an ambulance needed. So, we're hopeful, and I know you guys are. It's taken a lot of work, though, because part of the problem is getting the 911 operators, because you've had to go through a process to get them retrained and how to identify what's the difference between a call where it's a police response versus a medical response. Can you describe that, and what training have your fellow personnel had to go through to help respond and change this paradigm?
Thank you, Mary, and I appreciate the compliments. And I know I work for the agency, but since I've been hired here, and before that, we've hired paramedics. So it's not uncommon to have every single person responding be a paramedic. And I think that's unique for us. And, Denise Pangeline, our communications director, has, in my mind, probably the best dispatch center around. They're trained for medical emergencies, giving EMD over the phone, help instructions and all that. This is a change for us. And as I mentioned before, minimum training for paramedics coming into this. So this is kind of our first step, and the first part of this process was we know we've got to raise our knowledge and skill set up. So what we've done is, and I think this is unique to us also, is that we put together basically we call it generalist training. It's 3-4 hour blocks of time where we have law enforcement, fire, EMS, and dispatchers in the same room with a mental health professional, covering, there's probably over 20 training objectives, like drivers of demand for crisis care, culture and safety in the field, crisis theory, principles of optimal change. I mean, there's a long list of
Right.
topics that just to raise our skill set up. And that's kind of our first step is raising that bar. And we're not to the point yet where we're changing our dispatch procedures, but that's kind of the what next for us, and changing how we respond to these emergencies, whether it's, as you mentioned, right now, law enforcement will go in first, and we typically stage. The first part of this is the call coming into 911 and trying to determine when is that appropriate. Are there any indications of violence? We may not be able to change that if there are. Police might have to go in and make sure the scene's safe for everybody. As you mentioned, we don't carry guns, we don't carry tasers, we don't carry anything to protect ourselves. So that dispatch part of it is crucial. And then at that point, once we are able to identify calls that we feel is appropriate for EMS to go in first, we'll basically have law enforcement staging, and it's typically outside of the area, maybe a block away, in case it's not what we expected when we showed up. So there's a lot of starting at dispatch when the call comes in to how we actually respond. It's kind of a triaged approach. And then we'll be able to see too, I know we've had instances where it's overwhelming with the response. And I think where we're going with this, it's going to help that to minimize or limit who's going into the house to start the assessment, so it's not so overwhelming. And I think that's a key part of this, is that we'll be able to do those types of things.
Yeah, this is really a hopeful program. And again, to change the dynamics and change the outcome. All we want is better outcomes for everybody, for the officers, for your staff. This is exciting. And I know we're going to hear from Dr. Chad Pierce later about the county. The good news is though, as this pilot program goes along, retraining the 911 operators, your team, county sheriff is right behind there. They're ready for their dispatchers, our team, even here in Danville, to retrain and add this so that everybody works in concerts, and to recognize those things and put the right people in the right position to hopefully deal with the crisis in the right way. And I know that we can do this, because when you look at this, we became a heart-safe community. And how did that happen? And by the way, Deputy Chief, I was saved by your 911 operators because of their skill set in helping my son deal with my heart attack when I didn't know I was having one. And they walked him through. They knew by the words and everything of how to tell him what they could hear in the background on the phone, all of that. That's an incredible skill set. And the same way, if we apply all of that talent and that skills with the right training, that we should be able to do this for mental health. And the realization is mental health has changed. New York Times just had an article early this week, and they did a survey from February over February. And for adults, there are 25% of every adult, this is a nationwide survey, 25% of every adult admitted that they had a major mental health issue crisis over the past 12 months. They also found that 10% of all children had severe mental health issues. And clearly we've all seen from the schools, and we're going to hear from Nitsa in a few minutes, we've seen it in our schools. So we're at the right time. I wish we had it sooner, but truthfully, this is how we're all thinking. This is going to become a normal. And what we're hopeful with what Shawn was talking about, 988 program and this first responder program, that we have the sustainable funding to make this normal, to make this part of our life. If we think this is a one-time shot, it's a foolish endeavor. I know we're all committed here in the Valley and everybody else. So Jim, we look forward. When is this officially, is the last question, when is this officially going to get up and running, and that we know this pilot program? And obviously it's starting in San Ramon, and that there's some technical reasons we don't need to talk about that, but we need to start a pilot. When's that going to happen?
Right now we're kind of at that foundational level where we're diving into our data and analytics to truly identify the what, when, and where of the issues that we're seeing with our district. The next step after that's going to be, we've already reached out to Dr. Kadani, Marshall Bennett. They're with the local emergency medical services agency with the county. And through them, they're going to be helping us kind of reach out to other like A3 and other programs within the county to see if there's any areas that we can collaborate, learn from each other, see where there's gaps that maybe we can help bridge from the 911 side of this. So it's going to be stakeholder collaboration. And then from there, we'll be looking at tweaks to our policies, procedures, how we respond. Do we really need to send an ambulance and an engine to every call? So you're going to start seeing changes where policy and procedure change, which comes out of that stakeholder development and the deep dive into our data analytics to make sure we're making changes and we're putting resources where it's going to make the most difference. So I don't have a hard start date for it, but we're working towards that. So hopefully within this next year. Oh, there's one other thing too. We've got a single role paramedic program that's they're going through their training period right now. They've been trained a little bit higher. They've had 40 more hours of mental health training and some experiential training there. That's actually going to be, that ambulance is going to be housed at Station 31 right off Sycamore. So they'll be in Danville. So their training's going on. So hopefully in the very near future, we'll start seeing some incremental changes to policies and procedures and moving forward.
That's great. Well, I know what I always admire about the discipline that fire has, it's about training, training, training. You spend every day training or actually dealing with a circumstance. So I appreciate the caution and the sincere concern that you're taking to get everybody up to speed. And we look forward to that and in being a partner with you as well. So thank you. So let's turn to Dr. Nitsa Dimitrakos and talk about, this is Discovery Counseling Center has been around a long time, a private agency, but yet you interface a lot with the public agencies. And Nitsa, maybe you can talk about, maybe give us a little background. What's the goal of Discovery Counseling Center? And then also let's talk about what are the public-private partnerships that you have? And then lastly, we're going to go to what have you seen over the past few years? We'll leave that part to the last because it sort of sets up why we're all talking about this today.
Thank you, Mr. Mayor, and good morning to everyone. Thank you so much for inviting us to be here, and I'm thrilled to be here on behalf of Discovery Counseling Center. Yeah, this is a really big conversation, and I want to preface my piece by saying it's vital that we continue the collaboration because mental health, it's complex, it's challenging, and it's multidimensional. So we have to have all of these moving parts. As you mentioned, Mr. Mayor, your connection to Discovery is very long and well involved. We've been around for 50 years, 50 plus years? Yeah, it started off quite small and here we are today. So our goal at Discovery is to really offer early detection, to offer a secondary level of prevention, meaning we want to detect, we want to get in there and do prompt interventions with the community. So we serve everyone in the community, from children to our senior populations. Most exciting as well is our training program. So we are training the next generation of therapists. We have over 14 licensed staff, and then we've got 39 trainees with us. And we partner with the San Ramon Valley Unified School District. So we've got interns in every school in the district working with our children, and that's that early detection piece. So our goal is we understand that by the time we get older and these patterns are really in place, it's much more difficult to unwind. If we can catch what's going on early, we have a better chance at doing some really good intervention and preventing future problems.
It's kind of like that light touch, sort of my simple way of looking at it, that sometimes, particularly with young people and even adults, when you have that first experience of recognizing that you are having issues, just having somebody to say, this too shall pass, is enough. And you're right, in that light touch approach, getting there early and young, that you can help change that so the small problem doesn't turn into a big one.
That's right.
Can you talk a little bit about, now it's called the SKIP program. And so you're embedded, there's 34 schools, I think, in San Ramon Valley School District, and 35,000 students. And so how does that work? And I know you've got both in elementary school, all the way from TK to the middle schools and the high schools. Can you describe how that worked? And what are you seeing for the past couple of years? Because obviously kids have been on Zoom, they've been in all these disconnected particularly. And is there a difference between the young children and the older ones?
Yeah, thank you. Excellent question. So just to give you a little overview of our program. So in order to become a licensed therapist or a clinical psychologist, we all need to do a certain amount of hours in training. So our program is for master's level and doctoral level students that are getting hours towards licensure and training. So what we do is we assign one intern to each school. As you mentioned, TK through 12. The intern is on the campus twice a day for the most part, and they carry a caseload of about 10 students. So the way it works is in the classroom, a teacher might identify something happening for the student. Parents might call in and say, there's some, we're going through this thing at home and we want some extra support. Sometimes for the older kids, teenagers might even come in and say, I need to have some support. So there's a referral made. It's given to the SCIP counselor. And then they do all the paperwork and set up a time to see the child one-on-one, one time a week. So it's for about 40, 50 minutes, depending on the age of the child. The issues that we see are across the board. Whatever you might imagine, we're seeing anxiety, depression, suicidal ideation, domestic violence, incarceration of parents, socioeconomic issues, cultural issues, adjustment issues, some physical medical issues where children are maybe newly diagnosed with a cancer or there's another physical ailment in the family. So just anything you can imagine, it's present. And to answer your question about what we've been seeing, what the trends have been, and of course, COVID, we're still kind of coming out of COVID. So a big trend is anxiety, depression, suicidal ideation, academic overload, where children are burnt out. They just don't have the capacity to sustain the level that they're feeling they need to sustain. So for the older kids, it's a lot of anxiety, depression, suicidal ideation, but even for the younger ones as well.
Wow. Well, it's amazing the work you're doing, and it's a unique asset to be able to be in every single school. And this is a problem, as you know, and I know the Assemblywoman also is concerned about is how do you provide that funding to do this? We're fortunate here because we have a funding mechanism of a group of women volunteers who provide nearly $500,000 a year. But the other part of, along that line, the other part of Discovery Counseling Center, it provides unique services. It's for people, and surprisingly, a lot of people who can't afford the services. Maybe you can describe how does that work, Nitsa?
Absolutely. So yes, absolutely. And just to say our SCIP services, that's through the district. So for the parents, for the families, that is already a paid service. So families do not pay for that. In the clinic, we have a sliding scale. And so we've got, people come in and that's usually an issue with mental health. Usually the finances is a problem and that's part of the problem, and we recognize that. So we offer a sliding scale and helping people out to ensure that they're getting the care that we need. And Discovery Counseling Center is very fortunate. The goodness starts at the top. So we recently have a new executive director who has joined us, Sumita Bandari. And Kathy Shiverton has been with us for 10 years or so. And, the values are in the right place. The intent is in the right place to serve the community. And that oftentimes means serving people that don't have money. So we're very fortunate to have the thrift station, as Mr. Mayor, as you mentioned. And we have so many donors in the community that we're so grateful for that allow us to do the work that we do. And it's amazing, the work that people are doing. I'm in awe. I mean, genuinely, and the feedback that I get from parents, and I see people that learn who I am at Discovery, and everyone's got a story to share.
Right.
It feels like everyone's got a story. So, yeah.
Well, and really appreciate, there was another program, and most of us, even the fire department was involved in this, but it started at Discovery was, when you see mental health, you could see kids hanging out in front of a store. And, sometimes you'll see particularly that lone person, and they're wearing a hoodie and their head is down. And most people by nature would walk around that person, even though they're young.
Mm-hmm.
And recognizing that most people don't know how to deal with mental health. So Discovery took the lead to take what was a program that was started elsewhere. It was called Mental Health First Aid. It used to be a 2-day class, and now it's a 1-day class. And the goal was, we had everybody in Discovery and the board do that. Went to all the public agencies, they had their people take those. And the whole concept was lean in. Not that me taking a class for 2 days, all I could do, I know more about mental health, but I know the most important thing is to lean in, talk, and help that person get to the right help. I can't solve their problem. And that was impactful. So at the town and San Ramon, we had all of our staff that touch particularly children to go through those classes and stuff. And so that was a foundational kind of thing that's kind of gotten us why we're hearing about this. And we're going to hear from Dr. Pierce in a moment that talks about all these things we're doing, because mental health has always been there. We just couldn't lean in because we didn't know how.
Yes, and really quick, I'm sorry, I just want to say, we may not know how to, we may not feel we know how, but we're all human. So that there's so much that each of us do know. We do know what it feels like to be in pain. We do know what it feels like to not know or to be uncertain. So tapping into that, I think, is so fundamental to lean in, as you say, and help another.
Right. Yeah, better outcomes. Well, and thank you for Discovery. So now we're going to go to Dr. Pierce. Thank you for waiting. Dr. Pierce is the acting mental health program chief of Contra Costa Behavioral Health Crisis Services. Dr. Pierce, we're delighted to hear. You've got to hear about the other things. Can you share with us about what the county's doing? And then also we kind of want to go through, what are the other services the county? We're talking about the rapid response, and that's kind of a program that's been there, but it's really scaling up. Can you share with what's happening?
Sure. Thank you, Mr. Mayor. I'm happy to be here and just excited to hear the other panelists and the other pilot programs that are going on. A3 is a community-inspired, county-wide approach, and we're really trying to offer a more thoughtful, safe, and supportive way to address the behavioral health crisis. So as already mentioned, we know that 1 in 5 adults experience behavioral health issues. It's the 3rd most common call for an ambulance, and currently we have 10,000 plus involuntary holds in psych emergency for psychiatric reasons. So we recognize that this is a need that we really have to address. And so, like, for example, when someone faces a crisis, they call 911 with the expectation of, you get fire, crime, or medical emergency, you get immediate emergency services. However, when that emergency is a behavioral health crisis, we really don't have a comprehensive response system available in our community. So what we're trying to do is address that need by being the 4th arm of that emergency response system. So our goal really is to avoid the needless suffering and prevent people from being stigmatized, criminalized, and prevented from getting the help they need when they need it. So A3 is our innovative approach for providing timely and appropriate behavioral health crisis services to anyone, anywhere, at any time in Contra Costa County. And that's why we're calling it A3.
That's fantastic. Can you tell us some of the details? How does it, somebody makes a call and it's determined that it's a mental health, what happens next?
So the way the model works is we want there to be no wrongdoer. So any call that is recognized as a behavioral health crisis, it would be routed to our Miles Hall Crisis Hub call center,
Right.
where we have trained clinicians and peer support specialists who answer the call. They then triage the call to determine the need. So many of the calls can be de-escalated over the phone, but then sometimes we may need to dispatch a team. So we have 3 levels of teams that can go out. Our level 1 team is really like for our lowest acuity calls that don't require a licensed clinician necessarily. So it could be an EMS going out with a behavioral support specialist or a peer support specialist that might be like a social welfare check or something like that. Our level 2 calls are more acute, where we recognize that there is a behavioral health issue requiring a licensed clinician and a peer support specialist. And when I say peer support specialist, I mean folks with lived experience who can also really relate to the family and to the person in crisis.
Yeah.
We also may have on those level 2 teams a substance abuse counselor who can go out and help if that's the need. But we are trying to lessen the need for having law enforcement come out. However, we then have our level 3 teams, which consist of the licensed clinician, the peer support specialist, and law enforcement, either on standby or to help coordinate if we see that this call may be a situation that may escalate and there may be safety issues. So that's kind of like the call center and how the teams get dispatched. The other thing that we recognize is that folks need a place to go. They don't always need to go to psych emergency or be hospitalized or go to jail because of certain, they need other places to go. So we're building out our campus in Concord, which will consist of a peer respite center, a sobering center, and an urgent care for folks who need a level of care. They need support, they need a place to go, but not like emergency or hospitalization all the time. So those are kind of like how that model works. And so we're in the beginning phases. We're starting the construction, and we really are hoping to be 24/7. Currently, the Miles Hall Crisis Hub is 8 to 6:30 Monday through Friday. But as we scale up, we hope to be 24/7.
That's fantastic. I mean, this is so exciting. So the way, I guess, the mechanics work and what we've heard from the sheriff's department, they've been working with our fire department. They've been retraining their 911 operator system to be able to go through that triage on that call to know that they need to transfer that right away and make sure that they haven't transferred the wrong call. That's exciting. You know, that's been something I know that's been talking. It's a big scale. It's a lot of money. What are the challenges to keep that sustainable that you see?
You know, staffing is really a challenge. You know, it's really hard work, and really being able to retain staff, I think will be a challenge, just to make sure that people aren't getting burned out in doing this work. And, you know, it's a 24/7 operation. So that is one of the challenges that I see us having. And then just continue to have the training and really coordinating with all the law enforcement agencies across the county so that everyone's on the same page and doing the same, you know, coming from the same place. So I think that can also be a challenge, just because, you know, different law enforcement departments have their own ways of doing things. And we really are trying to collaborate and be consistent across the county. So that takes a lot of work, a lot of training, a lot of collaboration.
Dr. Pierce, that's a really good point. It takes everybody to have the same value proposition that this is a priority. And in a way, if we want to cut down all the recidivism and all of the incarceration, this should be our number one priority. And by doing that, it will then become institutionalized. And that's not a bad word in this case. Institutionalized means it will live here forever because it's not going to go away. And maybe I can ask Shawn to jump in on this. You know, what Dr. Pierce was just saying, and I think the Assemblywoman was recognizing this as well, is that there's a problem for all the job openings. There isn't the supply through our system of therapists. And I believe she's working on something. There's some program about funding. Can you describe that? Or
Yeah, and Mr. Mayor, if I may, I saw a question in chat about AB 988 and asking about whether or not that's synonymous with the Miles Hall Lifeline Act. And absolutely, I wanted to just mention that
Yeah.
the assembly member
Thank you.
wrote this piece of legislation to honor the memory of Miles Hall, a resident of her district who unfortunately was killed by police during a mental health crisis. And she worked with her family and the Hall family, you know, they did everything right, everything they were told to do, but unfortunately his story ended in tragedy. So I did want to just mention that, but yes, absolutely. The assembly member, along with a number of other legislators are pushing for what's called the future of California's workforce in behavioral health. This is a $1.7 billion one-time appropriation ask, which is going to be a game changer. They're also building in an ongoing $3.2 million investment. And what this aims to do is to expand by a third Californians or the number of providers who are able to work in the system. Because what we're seeing is we don't have the capacity currently to do this work. And you know, that's gonna mean that we need to create immediate, we have to have immediate action to stabilize our workforce. Because right now what we're seeing is we don't have enough people doing this work. The number of people who are able to access care continues to drop. And if we continue on this trajectory, people are going to fall even sicker, and it's going to many times lead to the most tragic outcome, and that's death. So, you know, the hope here is within our public behavioral health workforce, its contract providers and other settings, particularly in regions with longstanding provider shortages, that we would boost that workforce in those spaces. It also proposes that we have a substance use disorder workforce that's on parity with the mental health workforce. And we believe that this workforce should reflect the holistic meaning of behavioral health. And it would do this by creating a robust career pathway, which will feed into the behavioral health system all the way from high school through licensure. And these pathways should support underserved communities and provide multiple points of entry and reentry to these kinds of licensure and non-licensure positions alike.
This is the jumpstart we need. And I know, go back to Dr. Pierce, that I'll be honest, the question is, it's always about funding. Dr. Pierce, is there sustainable funding that you have to keep the A3 program going, or are there challenges, and what can we do to help support that?
Fortunately, we have Contra Costa have a half-cent sales tax.
Oh, yes, right.
And the Measure Act.
Correct.
And so we were awarded funding through that. So we have $5 million one-time funding for our infrastructure, our facilities and technology. And then we have an annual amount of $20 million to sustain the program ongoing through that sales tax. And we also have other federal funding. Yeah, so
wow.
How you can help is just by being involved. We do have a behavioral healthcare partnership meeting that occurs once a month. And so for the community to get involved, because it really is about the voice of the community expressing what the need is for Contra Costa County.
That's fantastic. And I want to make sure that this is really clear, is that all the programs we're talking about, when you think about it, and right now our 911 system was basically for two purposes originally. It was for fire and police, and we're not changing that. We're just trying to make it a better system to add these other services and to get better outcomes, and not blaming anybody for anything, but it's the system that we all set up and we were willing to go along with. But society has told us, and the outcomes that we're seeing and the lessons that we've learned are guiding us in a different direction. And that's how change happens. And there have been some absolute tragedies, both here in Danville and elsewhere throughout the country, that have happened. And we're providing better training. And more importantly, we're providing the services that people need. And when you only have one tool in the toolbox, you use that the best you can. And now we're trying to make sure we have all these areas, four tools in the toolbox. And I hope Nitsa, Dr. Pierce is talking about, I know that we can get somebody from Discovery to sit in on that meeting, because I think that's just great, since we represent on discovery, that private side, what else we can do. So we have just a few minutes and want to ask maybe some other general questions. And I'm going to go back one more time to you, Dr. Pierce. What are the other services besides the A3 program that the county offers? And there was a question earlier that goes along with that, is if somebody in our community or any community here comes in on a mental health call and they get taken to the county hospital, their insurance doesn't cover it. Is there something that can be done? Maybe Shawn, you can listen in on this. Is there some gap that we need to fix so that a private insurer who would normally cover it, but because you went to a county facility says, oh no, that's their responsibility? Do you know anything or could add anything about what those challenges are?
Well, it's kind of like how the regulations are set up, that if you're in Contra Costa County and you call 911 and you need to go to psych emergency, that's the way the system currently is. I do agree that there's a gap there and something needs to be done. And that's part of what we're doing with A3 is trying to avoid that happening. So A3 would be anyone, anywhere, anytime. That's not going to be a cost. And if you come to an alternative destination, you would not, the goal would be that that's not going to negatively impact you financially. And then we would route you to your private provider if you have one. But in the meantime, during the crisis or that part of the behavioral health need, there will, we're serving everyone. I mean, that's the goal. We serve everyone in the same way as possible. So I hope I'm answering your question. There is a gap right now because they do all go to psych emergency. And that's just that's a system change that's needed.
That's good to know. Yeah,
and also,
yes, go ahead. Sorry.
And being able to even divert going to psych emergency, and if a clinician recognizes that a hospitalization is needed, being able to admit directly into the hospital, like John Muir, for example.
See, that's the pivotal point, because we'll create more capacity there, because we'll relieve the county for those that have no other alternative. But what's exciting is with your A3 team, if they can, on that lighter touch, say, yes, you should go to John, it will put the circumstance in the situation. We can do that. And Shawn, maybe that's something you could take back with your team. Talk about, are there some legislative things in the insurance world say, hey, it's not fair that just because they had to go out of service under that circumstance, and there could be times, even under the new A3 program, that they must go there because it's a life-saving situation. Maybe there's something to talk about on that.
Yeah, that's great feedback.
And Dr. Pierce, I'll put you on the spot with a nice question. Danville is looking, as you may have heard, we've been trying to funnel money, one-time money. It's all, unfortunately, it's all we have, one-time money to try to help support mental health services in appropriate touch points. And we've been able to help Discovery Counseling Center, some others. Is there an area or something that you know of that we might be able to, if you said, gee, if you only have one-time money, it ought to go where? Is there a place? And obviously, you're representing your department, and we assume we want it to go to mental health. So it's not to the whole county health. Is there a spot you think it ought to go to?
You know what? I would have to get back to you on that.
Okay. No, that's okay. I challenge you to do that. I would like to hear from you, and particularly given your position there. Yeah.
Sure.
Oh, great. Okay, let me go back. Let's open this up again. Nitsa, is there, we've been talking and you've been listening. Is there anything else you want to add to this conversation? Anything?
Well, I did get a question. I don't know if those questions are public for everyone, but someone did bring up a really good question around how conformity and upholding the status quo negatively impacts children. Right. And their ability to grow, adapt, and feel. And I wanted to address that. I wanted to voice that. Sure. That's quite a big problem, I think. We're fortunate to live in an area where we want our children to succeed, and we want to have them live healthy, progressive lives. And at the same time, we're sort of shutting out different ways of being. And children are getting this false narrative that there's only one way to success and that success means a particular thing that just really isn't true.
Particularly
So-
academics. I mean, the pressure here in this community is huge.
Absolutely. And there's great things to that. I mean, we're privileged in that way. And it's important for us and for the parents and all of us to understand that there's also a distortion there. There's also, there are different ways of being successful in the world. People come with different gifts that show up in different ways. And it's super important for us to be able to support different ways of being and to understand that success is not just a financial glory with an empty sense of self and depression. That's not success. Success is to be able to live and feel a part of the community and to communicate and to thrive. And that is our goal at Discovery Counseling Center. That is the goal, is that we're not just succeeding, we're not just doing well, we are thriving as a community. We want our children to thrive and we want our adults to thrive. So I don't necessarily have the answer and we just have a few minutes left. So, but definitely one piece is to continue having the conversation, continue educating, continue us collaborating. So I just really thank you again, Mr. Mayor, for allowing us to come to the table. And I hope that we continue this for the children.
Absolutely. I appreciate it. I know in speaking to Dr. Malloy, superintendent of schools here, their message to the teachers is to carry that out, to let parents know academic excellence, all of these things we're pressuring our children are great, but that's not the whole person. That's not the whole picture. And don't sacrifice those achievements over their overall well-being.
Mm-hmm.
And I know that's the foundational for all of us in mental health, but particularly at Discovery, it's not going to stop. We could be here for hours talking about this.
Months.
Because it is. And like on the video, the very last thing, and it was something personal to me about, offer your hand to somebody. You can actually help somebody. Just offer your hand, friendship, to talk to them and share your experiences and get them to talk about what they're feeling. And it's okay to ask. Don't use, the words and the vocabulary that might be trigger points that, are you feeling whatever? You can just say, how are you feeling? And, do those simple things. And then as lay people, we can play an important role. And I think, Jim, what you guys are doing at the fire department, boy, it's, you are doing all the right steps, just like Dr. Pierce has mentioned, being careful, making sure you have the right amount of training, all the right systems in place to get the best outcomes. And we appreciate too that, the assembly member and Shawn, you and all the staff that work to support those efforts. You guys have done great things. There's a small thing I will mention, and it's something that has to do with an education code, who's a person. There are some barriers at high school level, because they're the ones who would want to self-identify that I need help, that there's a barrier, a step that they have to go through in order to see the counselor. And it has to do with parent permission and things like that. And I shared that with the Assemblywoman, and I know she's looking into that. That when kids get to high school age, they may have problems at home that they need to talk about, and their parents may not want them. And not that anybody's trying to intervene, but we need to provide the best safety. And I know there's some conversations around that, having a global authorization when you start as a freshman and parent signs, if my child wants to go in and talk to somebody, they have my permission, and it stands for all those 4 years. So with that, we're just coming up on the hour and our hour program. Thank you, Dr. Pierce. We look forward to being a partner. Please get back to me. We'd like to know how we can help. Deputy Chief Selover, we appreciate what the fire department's doing, and thank you for having that truck there. It's real close to my house, but it's right in the center of the valley. Let's think about it that way. Shawn, thank you, and the Assemblywoman for all the work. And Nitsa, thank you for everything you're doing. With that, let's be well, be healthy, and thank you again for being here. Everybody have a wonderful weekend. Happy Mother's Day to everybody. See you again. Thank you.
Bye-bye.
Thank you, Mayor.